الله الرحمن الرحيم. السلام عليكم متابعي ومشاهدي صفحة المعهد الوطني لأمراض القلب. نلتقيكم اليوم في صفحتنا باللغة العربية. معكم دكتورة أفراح يوسف، أخصائي أمراض القلب وقسرة الشرايين. سوف أستصحبكم في سلسلة من الحلقات للتعريف بالمعهد الوطني لأمراض القلب في ماليزيا، بالإضافة لبعض الحلقات التي ستتضمن العديد من أمراض القلب ومناقشتها معكم. مرحبا بكم على صفحتنا ونتقبل أسئلتكم. معنا اليوم في هذه السلسلة الداتو دكتور عزاني محمد طيب، رئيس قسم العمليات ورئيس قسم الجناح الخاص بالمركز القومي لأمراض القلب، وهو من كبير أخصائي جراحة القلب. فنرحب جميعا بالدكتور داتو عزاني. Okay. Without further ado, Dr. Izani, the head of operation and director of private healthcare and is a senior consultant cardiologist. He will be with us in this 30 minutes to talk about IgN, and we inform you that we are going to have a series of episodes. We talk about IgN and what IgN delivering type of services, and how can other people, especially foreigner, can get use of this kind of service. So for today, and in the other episode, we will talk about the different cardiac disease or heart disease, and we will share with you what questions and what run in your mind to know about it. So for today, as I mentioned, that Dr. Izani will elaborate more about IgN, the services over there. So without further ado, Dr. Izani, you are welcome in our Arab page.
And Thank you, Alpha. So you mentioned just now correctly IgN. Actually, IgN is a Malay name. It's called Institute Jantung Negara, which means it's the National Heart Institute in translation to English. Okay. It was formed way back in 1992, and many are not aware that IgN outside of China is one of the largest heart hospital in the Asia Pacific region. We do a lot of cases, and we have been recognized both internationally, regionally, and of course nationally. We have won many awards, and we are proud that IgN is now one of the world leaders in heart diseases, in management of heart diseases. Right? IgN has been identified as a flagship hospital for medical tourism in Malaysia, simply because it is of its experience, its facilities, the manpower, the expertise that we have, the amount of research that we do, and the contribution that we do for the country. That has been tremendous. So in essence, basically IgN is a heart hospital that treats many types of heart diseases, both in children and adults. And we are equipped with the latest sophisticated imaging, surgical procedures and things like that.
Okay, thank you so much for this informative information about IgN. So that means the latest IgN is يعني هي كلمة باللغة الماليزية وتعني المعهد الوطني لأمراض القلب، هي اختصار لذلك. كما ذكر لنا الدكتور داتو إيزاني، المركز يقدم الكثير من الخدمات، وهو من المراكز الكبيرة في منطقة جنوب شرق آسيا. تم إنشاؤه في العام 92، وهو يقدم خدمات لأمراض القلب وأمراض قلب الأطفال وبالإضافة للجراحة. أثناء جولتنا مع دكتور داتو إيزاني هنتعرف على بقية الأقسام. Dr. Izani, just if we need, if you can elaborate more about the facilities and the services that are available in IgN.
Okay, so first of all, I'm proud to say that IgN has been the key or cardiology service provider since 2017. We've been winning the awards of this cardiology provider since 2017 up to latest. So simply because of the amount of work that we do, and if you look the amount of workload that we do, the outpatients that we see, we treat approximately more than 300,000 outpatients, and we do more than 10,000 procedures a year. Now, the amount of facilities, the services that we can do, as I said, is whole spectrum of cardiology, from the baby right to the 90-year-old, right? So whatever, inshallah, whatever diseases that they have, we have the expertise to manage, both surgery or cardiology or imaging. We have a complete range of services that we can manage. And what's important is that we are supported with a team. If you look at our team of doctors, the experience, right? If you just look in cardiology, it's a combined experience of 250 years. Now, IGN is unique because it's not like one doctor practicing alone, but they can tap the resources of other doctors. For example, like in surgery, we have more than 200 years of experience also. So if I'm not sure how to manage this patient, I can ask any of my colleagues, and we combine together to do this. And all these are supported by a team of nurses, CVTs or technicians, pharmacists, dietitians with a combined experience more than 100 years to manage this patient. So we are like one big football team that works in synchrony to manage all these things. So I think in terms of facilities and experience, we are one
everything
best.
is there in
That's right, inshallah.
Right. اوكي، كما ذكر لنا داتو الدكتور عزاني، يعني مركز القلب يحتوي على كثير من الخدمات المقدمه، واذا يعني نظرنا الى الخبره بالنسبه لمركز القلب في معالجه وجراحه القلب نلقاها خبره كبيره جدا. يعني الخبره المتراكمه يعني تفوق ال 200 عام او ال 250 عاما، وهي يعني خبرات مشتركه من جميع الاقسام، في اقسام الجراحه واقسام الاطفال، ويعني حتى تتضمن خبرات التمريض. وكما ذكر لنا يعني هو من المراكز اللي حازت على كثير من الجوائز والاعتمادات العالميه. The two Dr. Izani, just I want to ask, in case, say, for example, if we have any emergencies with, say, for example, like any Arab patient had an emergency, is it possible for them to come through the emergency? Do you have any sort of service that's available for Arab and foreign patients?
Yes, of course. We have been catering for not just Malaysians, but also international medical tourists from all over the world. We treated patients from Europe, from the Middle East, from the rest of Asia, and even from America. So we have a lot of patients coming to IGN for treatment. And for patients who are either medical tourists from outside coming to Malaysia, or expats who are staying in Malaysia, but they are Arabs. Yes, of course, we have the facilities for them to come in. We have what we call an international patient center that assists in dealing with these patients. Both there's an interpreter dealing with accommodation.
So that means they speak in different languages, in
That's
Arabic
right.
as well.
In Arabic, of course, yes. There's we have an interpreter that speaks in Arabic to help them. And in case they're coming from abroad, from anywhere from the Arab world,
from their places.
We can help arrange for accommodation. We arrange for
that's
transport.
That's great.
We even arrange for pickup from the airport. So the minute we know that they're coming in, there will be a pickup point at the airport that brings them straight to IGN. Of course, now because of the COVID, there are some changes in the usual manner, but our usual practice is once we know that there's a patient coming in, we will arrange for pickup at the airport itself and bring them either direct to IGN if necessary or to the accommodation of their choice.
So that means the international center provide like a complete or comprehensive
That's right,
services
very
for patients.
comprehensive,
Taking them from airport down to IGN, the accommodation, after they finish everything, then what about the medical tourism? Do you take them around Malaysia? You know, Malaysia is a very nice country that everybody wants to see it.
Yeah, inshallah. Yes, we do arrange, and we have we work with the local tour agencies that help bring these people, these patients or these medical tourists around once they have completed treatment. In fact, we are looking into, sometimes they like to go to a spa-like resort that we can arrange, and we do have good corporate rates with these people that we can help arrange. But I think what's important is we offer a very comprehensive service, not just the medical component, but the personal touch, and of course, as you know, being a Muslim country, all the food is halal, so it's very,
that's good.
it's very easy for
And I
our
think it's very
patients.
good for Arab people.
Yeah, so they don't have to worry. IGN is a halal certified hospital, so in terms of the food, inshallah, it's all not a problem. So we cater for all these tourists, and I think inshallah we have no problems in assisting them in whatever means possible. We even arrange extension if it's necessary, things like that.
Yeah, this is one of the very important
Yes.
thing. Usually there's a visa and visa extension. All right. يعني الحمد لله زي ما ذكر داتو، يعني مركز القلب بيقدم خدمات كثيرة جدا، ممكن نقول إنها خدمات على مستوى فندقي عالي جدا، من استقبال المرضى من المطار لحد إيصالهم إلى المستشفى، وممكن يوفر لهم الفنادق ومواقع الإقامة إذا رغبوا في ذلك. ده بالإضافة لكل الخدمات والتشخيص اللي بيبدأ يعني من الفحص العام بالنسبة للمريض إلى ينتهي إذا كان المريض حياخذ عنده عملية أو قسرة علاجية أو غيره. كذلك هم بيوفروا عدد يعني من يعني لديهم كثير من الوكالات اللي تعمل معهم في مجال السياحة، فبنهاية الرحلة العلاجية ممكن ياخذوا جميع المرضى في سياحة علاجية حول ماليزيا، بالإضافة للجزئية بتاعة الإقامة وتمديد الفيزا إذا قصرت، فهم يعني بيشتغلوا في هذه الجزئية. Okay, we would like to know more that to Izani. Okay, as we know, heart disease is not it. Sometimes it related to other specialties. Say, for example, we have all diabetic patients, we have some patients with other.
Yes.
Do you have this kind of service like in the same place to make life easy for patients?
Yes. So one of the important components in IGN, right, the private healthcare division, is that we understand that the patient's disease is not just confined to the heart. So our vision in the IGN private healthcare is actually to provide a very comprehensive treatment, encompassing not just the heart, but anything related. So it's the brain, it's diabetes, or endocrine. So sometimes they have problems with breathing. So there's a lung physician that comes in. They have problems with kidneys. A lot of them are diabetic, so they have kidney problems also. So we have kidney specialists over here to assist.
So that means you have different departments or different specialties.
We have different specialty that provides all this treatment. And what's very interesting is that we are now moving forward with a team of sports medicine. That means, people who are interested in sports, they want to know whether their heart is okay. And then we combine that consultation with a sports medicine specialist. So there are two specialists who helps the patient to help for their sports activity.
So now you're expanding more in terms of specialties. That's great. Okay, I saw one of the slide that you have this wellness center. Basically, what about this wellness?
The wellness center or the health screening center is located on the 6th floor of the Block A in IGN, and it's what it does is it provides a very comprehensive type of health screening for people. It can be for local or medical tourists, and we specialize obviously in the heart. So we're able to, in that one-stop center, the wellness center.
Is it only for like heart patient, or what kind of people can come to the wellness center?
No. People as young as 20s we encourage. Because it's best to know whether you have any problems from a young age, and then you can deal with those problems instead of waiting for the complications to happen. So the health screening involves many types. It involves just a straightforward ultrasound of the heart, to a scan of the heart, to actually stress tests, all the special tests that we can do. And besides that, we also do cancer screening. We do screening for, now with the COVID pandemic, we even have special packages to look into if you have COVID and whether your lungs have been damaged because of that. So we have special packages for those sort of things too. So
and
there's a wide range.
All these tests done in how many days, or does it require?
No. It's in one day. So you come in the morning, inshallah, you come in the morning, you get a series of tests, and by the afternoon you get seen by a cardiologist and like yourself. and inshallah, and then they get all their results.
Okay, so that means it does include consultation and then
The test,
all the blood testing or all the screening tests and then okay, that's great. So بالإضافة يعني لما يقدمه المركز من خدمات لأمراض القلب، توجد خدمات مساعدة أخرى. يعني لديهم عدد من اختصاصي الغدد الصماء، أخصائي الجهاز التنفسي، بالإضافة لاختصاصي في يعني زي ما نقول هي يعني الفحص العام للرياضيين، يعني ده مختص في الطب الرياضي اللي هو ممكن يعمل فحص عام لأي رياضي قبل ما يبدأ الرياضة بتاعته. الحاجة الممتازة جدا تبع هذا المركز عندهم قسم خاص للفحص العام بالنسبة للمرضى، هو مش للمرضى، لأي واحد عايز يعمل فحص يعني للقلب بتاعه. ودي ممكن أي زول عمره أكثر من 20 سنة ممكن يجي للمركز بيسموه الوالنس سنتر، ده موجود في الطابق السادس بالمركز القومي. في يوم واحد فقط انت ممكن تعمل كل فحوصات القلب بتاعتك مع الاستشاره الطبيه، يعني بتعمل فحوصات الدم، صوره الاشعه، الموجات الصوتيه للقلب، بالاضافه لرسم القلب مع المجهود، يعني ممكن تعمل الفحص كامل للقلب بتاعك، فهو مفتوح لكله، بالاضافه للفحص ما قبل العمل او الناس اللي عايزين يدخلوا الجامعات اذا احتاجوا لاي فحص طبي ممكن يكون. Okay. For IGN being this big center, having these like I think national and international connections, was it involved in any sort of like joining any of these clinical trials?
Okay. See, before I touch on that, what I want to highlight on is something which is not well known
for IGN,
but something which about our emergency department, right? So I just want to say that, as you know, heart attacks is so common, not just in Malaysia, in the in the whole world. But IGN is really proud to have a 24-hour emergency center that is able to treat patients within 60 minutes when they arrive. What I mean is 60 minutes is that if you have a heart attack, we have a team of specialists ready to push you straight to the cath lab to open up the blockages that has happened within 60 minutes. If you look at the international guidelines, the American guidelines is within 90 minutes. But inshallah in IJN, you come in, less than 60 minutes, you're able to perform that. That is something that's not well known. So if you happen to be in Malaysia, whether you are a medical tourist or you just staying for holidays and unfortunately you have a heart attack, the place to come inshallah is IJN, because we are able to manage it.
It's great. So it's open even for like foreigner who they can come indirect. And I heard there is like some sort of survey that you can sign even your service down to their place, say if they call a city number in IGN.
Yes, that's right. Yes, we work with an ambulance provider that can pick them up from anywhere they are within the Klang Valley. And going back to your question about research and also whether we partner with any other institution, yes, we do. In fact, IGN is one of the premier center for research within the region. We have publications, many publications over the years, more than a few hundred, and we always embark on clinical trials.
Is it really a big number?
It's a big number, yes, because of the population that we have. So all the multinational companies are interested to tap on our resources, on our data, and those data can be used to help create new medication and to see the effectiveness of medication. So yes, IGN definitely is a major center for research and clinical trials.
اوكي، ده كلام ممتاز جدا. يعني نبدا بالنقطه الاخيره، انه المركز الوطني او المعهد الوطني لامراض القلب بيشارك في كثير من البحوث والمنشورات والتقارير والاقتباسات العالميه، وده يعني بيخلي انه المركز يكون نوعيه العلاج اللي بيقدمه هو يعني مطابق ومماثل للمعايير العالميه. يعني نوعيه العلاج اللي بتتقدم، مستوى العلاج اللي بيتقدم هو تابع للمعايير العلاجيه. وزي ما ذكر داتو دكتور عزاني انه المركز يعني بيستقبل عدد من المرضى، ده اللي خلاهم انهم يعملوا كل هذه الدراسات ويشاركوا حتى في الدراسات العالميه. ذكر لنا برضو انه عندهم خدمات الطوارئ ودي مفتوحه لمده 24 ساعه، وبتستقبل يعني كل المرضى، يعني اذا كانوا اجانب اذا كانوا محليين، ويعني بقت مفتوحه لكل المرضى العرب انهم ممكن يجوا الطوارئ في المعهد الوطني لامراض القلب. مثال يعني زول جاته اي ذبحه صدريه ممكن في اقل من 45 دقيقه تتعمل له كل العلاجات، ابتداء من رسم القلب على قسم الطوارئ نهايه بعمليه القسطره، ودي بتاخذ اقل من يعني اكثر من 45 دقيقه. يعني الخدمه دي موجوده، بالاضافه لانه عندهم ارقام بتاعه طوارئ معروضه في الصفحه بتاعه المعهد الوطني لامراض القلب، وهم ممكن يرسلوا عربات الاسعاف الى المواقع بتاعتكم. Okay, so Datu, for this like IGN sharing in all these clinical trials is a very big center that like treat the majority of medical illnesses. Is there any chance, say for example, for the foreign doctors to come and get some sort of training here?
Yes. For training, for training, of course. IGN has been long established as a training center. You know, it's very interesting because when I first started many years ago, right, all of us had to go overseas to gain extra knowledge in the field of heart diseases. But Alhamdulillah, over the years, IGN has been recognized as a teaching center. So we have trained a lot of people from all over the world. Places where we used to go for training now send people to our place for training.
I mean, we had see how big number is.
That's right, the big numbers. Even actually, when we have conduct courses, the Australians come over. The Japanese come over. We used to go there for training, and in Europe, of course. So we are actually a regional center for a lot of the ASEAN countries, and we are also a favorite center for Middle East countries. Simply because first, it's a Muslim country, it's very easy for them to settle down. And second thing is that because the volume of cases that we have allows them to learn a lot faster, and that makes it much easier for this people. Yes, the process is very simple. There is you can go to our website and you can apply via the website for a training post in either cardiothoracic surgery, cardiology, anesthesiology, or even pediatric cardiology. So yes, they are most welcome to come. It's just that currently, because of the COVID, there are obviously some restrictions, but once that is over, then inshallah it's not a problem.
Actually, basically, I have asked this question just with the intention to give the confidence to the other foreign doctor that IGN provide this kind of training, and even they have the short courses, or for all foreign doctors. Actually, I myself, I have get my training in IGN, and I'm proud of this.
Alhamdulillah.
Yeah, Alhamdulillah. So مركز القلب كما ذكر لنا داتو انه من المراكز المفتوحه حتى للتدريب بالنسبه لجميع الاطباء، وهو يعتبر من المراكز اللي بتقدم التدريب للاطباء في منطقه جنوب شرق اسيا بالاضافه للاطباء العرب. أنا شخصياً من الأطباء اللي تدربوا في المركز القومي لأمراض القلب، وكان معي يعني عدد من الزملاء من عدد من الدول العربية. زي ما شفنا حتى يعني تقريباً أكثر من 300 طبيب أجنبي أخذوا التدريب بتاعهم من كل دول العالم. يعني زي ما ذكرنا لأنه هو مركز متكامل، يعني من ناحية البحوث، من ناحية التدريب، من ناحية توفير الأجهزة. يعني مركز بيقدم الخدمات ابتداء من الفحص العام وانتهاء بجراحة زراعة القلب. Just I have mentioned to them, is it true that you have a heart transplant in IGN?
Yes, that's true. Yes, so in fact we did our first heart transplantation in 1997. And if you look at the slides now, IGN is the only center in Malaysia that provides a fully comprehensive treatment for patients with heart failure or advanced heart failure. So it can be heart transplantation, it can be mechanical heart devices, it can be ICDs, it can be surgery which is complicated, or even medical therapy. So we have a comprehensive team of doctors ranging from heart failure cardiologists, heart failure surgeons, anesthetists, and more importantly, or very importantly, are the allied health services, the nurses who are trained specifically to assist in heart failure management. So yes, we do heart transplantation. We've done almost 30 heart transplants and about 30 mechanical hearts. Alhamdulillah, they've been going on well.
Okay, that's good. So besides managing patient, you have this heart transplant. Okay, just in roughly how many patients per year you see in IGN? Is it like, how big is the number?
It's a big number. If you look at our statistics, it's been over the years, it's been going up very, very high from initially in less than 100,000. Now we are touching about close to 300,000 outpatients, and we treat approximately about 15 to 18,000 inpatients admission. Surgery alone, we do close to almost 4,000 procedures a year. So that makes us one of the equivalent to any big European or American center. And obviously outside of China and India, we are one of the largest in Asia. So we manage a lot.
So that means IGN is not only national, it's international center.
International,
yeah, it's
right,
international
yes.
center that it can compete with other international centers.
And as you know, we have the international recognition of the JCI, the Joint Commission International. So that is an American-based accreditation institution that actually goes around the world to identify hospitals that reaches or matches the standard of American hospitals. And Alhamdulillah, again, has been having this accreditation for almost 10 years already.
And you maintain it?
We've been maintaining. So we have that standard. So technically, we has the same level as any American hospital, if not better.
So is this a kind of like accreditation given like once, or yes, they have
every few years, every 2-3 years, they will come and reassess us with newer standards. And Alhamdulillah, as I said, we have been managed to maintain those standards.
And for sure, the standard, they will add the standard to be more and more.
That's right. It gets more and more challenging every time. Correct. Yeah.
اوكي كما علمنا انه المركز بيقدم يعني خدمات متعدده زي ما ذكرنا. يا جماعه احنا بنستصحب الاسئله بتاعتكم اذا كان في اي زول عنده اسئله بالنسبه لداتو دكتور عزاني فيما يختص بمركز القلب، الخدمات اللي بيقدمها مركز القلب. يعني احنا ممكن نستصحب الاسئله بتاعتكم، وزي ما ذكرنا حتكون عندنا لقاءات ثانيه. مركز القلب بيقدم خدمات يعني كبيره وجليله، وزي ما قال انه هو بيعد يعني هو زيه زي المراكز العالميه. ان يعني في لو رجعنا وعاينا للعبء بتاع العمل او عدد المرضى اللي بيتعالجوا، يعني في السنه الواحده المركز بيعمل اكثر من 4000 عمليه جراحيه، بالاضافه لاكثر من 10,000 قسطره علاجيه لقسطره تشخيصيه، ده بالاضافه للفحوصات الثانيه اللي بتتعمل هناك. Before we go to your, like I can see this slide. It talks about like you and one of your patients.
Yes, that's right. It was very interesting. His patient, he went to another hospital for treatment, and he did some search in the internet, and came over and spoke to me, and he was happy with what he saw, and Alhamdulillah, he went for surgery, and it went very well. And he's very happy. I'm happy for him. And this just reflects the many hundreds and thousands of patients, foreign patients that we have that we treat. And like this patient from your country, from Sudan itself, this one here, he had a valve replacement some years back, and so we treat a whole range. They can be as far as Sudan, Afghanistan, so it's in.
So you have lots of neighbors.
That's right. So, but the good thing is that we have people who are able to interpret, translate in case they have a language barrier that we have. So, this is, I think, very important because it makes the patient feel very comfortable when they can speak, in their mother tongue to somebody else, and those translators will then assist us in saying what the needs of the patient.
Okay.
And we actually even arrange special diet too. We can arrange with the kitchen diets to accommodate the needs of those people, right?
According to that, yeah.
Sometimes
I don't think most of the Arab people, they can tolerate the spicy Malaysian food.
That's right. Yes.
So that means that like easy for the foreign patient to get their appointment through the website and then they can come over.
Yes.
Okay, good.
We even have a WhatsApp number that they can WhatsApp, and we can inshallah
make their appointment and everything.
Yes.
Do you have any like sort of service? Say, for example, do you have any agencies in those countries, like in one of the Arab countries, to arrange everything before they're coming here?
We don't have an agent based in Arabic countries, but what we can do is that when they contact us, we can assist in managing that. Those arrangements, which is not a problem for us. And the good thing is that we, as you know, there's you and also Dr. Ahmed, who is an anesthesiologist.
And Dr. Ali in pediatrics.
Yes, and Ali in pediatrics, who are there to assist any of our Arab patients whenever they're in need. So alhamdulillah, I think that setup has been nicely arranged. And what's more important is all you need to do is just give us a WhatsApp message, and inshallah we can do the rest.
يعني بالنسبة للمرضى العرب هي العملية سهلة جدا، إنه يعني من خلال الصفحة العنكبوتية بتاعة المعهد القومي لأمراض القلب بإمكان أي واحد يعني يعمل المواعيد بتاعته أو يختار الأخصائي اللي هو عايز في التخصصات المختلفة، إذا كانت جراحة أو أمراض القلب أو حتى للأطفال. وبناء عليه تحديد المواعيد المريض ممكن يجي وياخذ. ده بالإضافة لأنه ممكن جميع المرضى دايما ذكر في البداية إنه في القسم الخاص بيستقبل كل المرضى وبيعمل لهم كل الترتيبات. إلى الآن ما في نعم يعني وكالات بترتب الحضور المرضى من مثلا من دولهم إلى ماليزيا، لكن الحاجة دي ممكن تتعمل بكل سهولة من خلال الصفحة بتاعة المعهد الوطني لأمراض القلب، الصفحة العنكبوتية. فممكن نعرض لكم العنوان بتاعها والناس بتمشي عليها.
You know, there's one thing, Afraah, that patients anywhere in the world can actually go to our website and see how well we perform. We actually publish our performance on the website. So you can see, for example, you want to go for heart surgery, you can actually go to our website and see what's our success rate, our complication rate, how long they stay. So if you see, you can go to our website and you can see all this. So we are very proud to tell the rest of the world, this is how well we perform. And inshallah, we continue to perform this well. If you look at, for example, mitral valve surgery, mitral valve repair, it's been a zero mortality rate for the last 3 years or 4 years. And alhamdulillah, this is, testament to... It's
good news that give the confidence to the patient to come and get their management.
So you can check on they can check on the website, inshallah. Yeah.
Okay, we thank you so much, Dr. Azani, for being with us
for
this, the first episode for this Arab website in the Facebook, and we will continue our other session. Just in general conclusion, I have to say it in Arabic, Dr. Azani, of what you have mentioned to them. So, المركز القومي لأمراض القلب هو من المراكز الكبيرة في منطقة جنوب شرق آسيا. تم تأسيسه في العام 92 وهو بيقدم خدمات يعني جليلة كثيرة جدا فيما يختص بأمراض القلب والأمراض المصاحبة لها من أمراض الغدة الصماء وأمراض الرئة، بالإضافة إنه بيوفر الفحص العام بالنسبة لجميع، يعني لأي حد عايز يفحص القلب بتاعه، اللي هي في المركز اسمه الويلنس سنتر، وده بيوفر كل الفحوصات وفي يوم واحد فقط أنت بتتحصل على النتيجة والاستشارة الطبية. إلى هنا نلتقيكم في حلقة قادمة. إن شاء الله سنستصحب أحد أخصائي أمراض القلب لمناقشة بعض الأمراض. الحلقة القادمة إن شاء الله حتكون في 22 من أكتوبر، وحنناقش فيها أمراض ضغط الدم. فإذا كان في أي حد يعني عنده أسئلة فيما يختص أمراض ضغط الدم، العلاج بتاعها، مضاعفاتها أو أي حاجة، you are welcome، يعني يا مرحب بكم بأسئلتكم. شكرا جزيلا و stay safe, stay tuned.
شكرا.
All right.